So first thing we have to check is our EHR for an order. So I have an order to insert a Foley catheter to a patient that has been voided for 24 hours due to urinary retention. I'm gonna check also, I do have an active order. I'm gonna check also for allergies such as latex, betadine, lubricant, and tape. So she has no known allergy. And then I'm gonna ask for help if I need to, but she's an alert-oriented, very cooperative, a lightweight person, non-combative. I'm gonna gather my supplies, so I will need a chuck, a sterile Foley catheter kit, a sterile glove extra, and a glove, wipes to clean the peri area, tape, and hand sanitizer. So I'm gonna wash my hand, or hand sanitize my hand before entering patient's room. Go to my supplies. Hi, my name is Christine. I'll be your student nurse for today. So I'm just gonna place my stuff here. Hi, mate. Please verify your name for me, please. Checking in the name bag. Full name, Christine Lacanel. Date of birth, February 23, 1987. Perfect. So today we will be inserting a Foley catheter to you due to your inability to void for the last 24 hours. Is that correct? Okay, when's the last time you have voided? Yesterday. Okay, how about how much did you void yesterday? Oh, just drops. Okay, well, I hope this Foley catheter will empty your bladder and hope you feel better after this. Okay, do you have any pain? Today is from 0 to 10. If you could rate it, 0 is no pain, 10 is severe pain, 0. Okay, perfect. I'm gonna go ahead and raise the bed in a comfortable position. Okay, I'm gonna keep you in a supine position, okay? And then I'm gonna go ahead and clean the table. Make sure I provide privacy in my patient. Up and down, up and down, up and down, up and down, up and down. Get another wipe. Wrenches. I'm going to remove my gloves. Open hygiene. And then I'm going to expose you for a little bit, so I need to put the chucks and then provide peri-care. Would that be okay? Okay. Perfect. There you go. Get my chucks. If you can lift up your bottom for me, please. Okay. Oh, perfect. Thank you for helping. And then position the feet in a dorsal recumbent position. And now I'm gonna go ahead and clean her peri area using the wipes. Holding the labia, inner, outer, bottom, top to bottom. The labia towards myself. Top, bottom. And the last one, which is the middle, locating my meatus. Top to bottom. Okay, perfect. Set aside. Now that I have that, and then my table has already dried, I'm gonna place my supplies in there. So I do have my Foley catheter kit. I'm checking for integrity of this, so I do see that it is closed, sealed. It's not damaged. It's not open. It's not. There's no leakage, or it's not wet. And I also have gloves. I have another latex surgical gloves. I'm checking for the integrity as well, making sure it's not open, it's not expired. Same thing here, it's not expired, it's not damaged. And then I have my hand sanitizer. And then I have my tape in here. Okay. All right, I'm ready to open my kit. There we go. Open this. All right. We're gonna put it right here in the middle. Okay. Right there in the middle. So I'm only gonna put 1 inch. Okay. Away, and the last one towards me. And then I'm gonna grab this one, drop it right there, and then surgical gloves. Okay, there we go. Place it on my clean table. Again, I can still see on my parallel vision my clean field. I didn't turn my back around, but I'm gonna go ahead and open this one. There you go. 1 inch border. 1 inch. Okay, now I'm gonna grab 1 inch. I'm gonna grab this one right here, up and away. Okay, and then grab this one, up, away. I'll have everything. I can fix my hand. Okay, and same here, fix. So now I have both of my hands unsterile. I won't be needing this one, but I will be needing to separate these. It's still in a sterile field. I'm gonna open my normal saline. Then I'm gonna open my Foley catheter, making sure. Here we go. I need that one. And put it back on my thing. And I'm gonna attach this one here. Attach it. Then open my lubricant. Then open my hydrogen peroxide. Put it on my cotton balls. Done. Now I'm ready to be one-handed. Putting my hand on the labia, separating it, exposing the meatus. Grabbing my tongs. Grab one. From the outer labia, top to bottom, drop. Another one, top to bottom, drop. And the last one, middle, top to bottom, drop. Okay, that's it. Now I will be placing my Foley catheter, 2 inches. I will be 2 inches, holding a 2 inches tip, putting in my lubricant. And then I would insert this. There you go. Keep inserting it. We'll keep inserting it until I see a urine return. Urine flow. Keep inserting. Okay, great. Now it's there. Now I need to, there is a flow, I need to stabilize it and push my 10 cc of normal saline. All right, there you go. Keep putting, pushing. Now it's empty. I can remove, I can see that there's a resistance in there. I can remove my thing. I'm no longer, at this point, no longer sterile. I am clean. I can remove my gloves, or I can remove this since these are not sterile anymore. Like that. Or this one. Remove my gloves. Sanitize. And now I'm going to clean up and clean her peri area with my gloves. Now I'm going to get my baby wipes, my wipes again. Cleaning it top to bottom. Top to bottom. The middle. Down. Now I can remove everything. All these needs to be clean. I'm gonna throw it in the proper disposal for facility protocol. So, but I'm gonna be using that for my later, for my thing. Remove my gloves. Get hand sanitizer. Get another glove. Before, I need to make sure that this is in a stable area below the patient's abdomen. Right there. There will be a bar, and stable doesn't move, non-movable. And then I'm going to put a tape on the leg, an inner thigh, assessing the inner thigh for any lesions, skin breakdown. At the same time, I need to make sure also that the patient is not allergic to any latex. Again, we checked the armband earlier. So I'm gonna go ahead and open, get a tape. Place this one right on the leg of the patient, the inner thigh of the patient. There you go. Now everything is stable. How was that? Did you have any pain? No. And I can remove also, hold on, I can remove also my chucks underneath. Lift up your bottom. There you go. Now I'm disposing that. And then I'm also noting the drain, if the urine drain, making sure that there's no unusual colors such as hematuria, blood in the urine. There's no foul odor in there. I also looked at her vagina earlier. I assessed if there's any lesion, any drainage, any unusual appearances. It seems to be everything normal. Is there anything else you need from me? Do you have any pain? No? Okay, I'm gonna go wash my hands. Lower down your bed, put your side rails up, place the call light, and again, earlier I've already provided privacy, but I'm gonna go ahead and ask her if she wants the privacy off. So, do you want it? Okay, because she wants the privacy out of the way. And then again, I have already lowered down her bed. Then now I'm going to go outside and document. Again, I already disposed this according to the policy of the building. I'm going to be documenting outside. Will be the size of the Foley catheter that I in place, which is the 14 French. I inserted 10 cc of normal saline. The urine flow was normal, which is yellow. There was no foul odor. There's no like residues. She tolerated the procedure very well. She didn't have any pain. She is emptying out her urine. Right now we are at almost to 200 ml of urine. I think that's it. Thank you.